Hi, this is Dr. Matt, and today we're going to be talking about scoliosis. Scoliosis is a condition that is defined by 10 degrees or more of curvature of the spine. So we'll often see a scoliosis either in the thoracic area, it can look something like that, or we'll see it in the lumbar area, which would look something like that. Now, the big thing about scoliosis is that the earlier that you catch it, the more you can do for it. You may have heard that young kids who have it, they often will put rods in the spine to try to straighten all that out. But ultimately, I've seen a lot of scoliosis in practice, and the truth is that by the time I see someone with it, it's too far along or it's been too many years, because once the spine is completely fused, it makes it a lot harder to change that. We really want to focus on the effects of the scoliosis. So one of the big things that we see is postural derangements. So if someone has a very severe scoliosis, they might come in with a shoulder that looks like this, right? Or hips that are higher on one side than the other. And this is a very common thing to see. So the idea of all this is that what we're going to treat are the surrounding musculature, because it gets really tight with that major curvature, and the subluxations or the misalignments that are caused by it. So again, because scoliosis is such a big misalignment in the spine, it can easily lead to earlier degeneration in the spine, and that is something that as chiropractors, we're always trying to prevent or prevent it from getting further. So again, a big thing about all this is to really come in to get your spine checked, because you never really know if you have a scoliosis or not. I can't tell you how many patients that have come in that we found a scoliosis and they never actually knew about it. And another treatment method that we sometimes use in conjunction with the adjustments and the therapies is a scoliosis brace. I'm not going to get too deep into that, but what that does is it helps to control the muscles that are really tight on one side due to the major curvature. Thanks for listening. We'll see you next week.